Good evening. Good evening and welcome. Good to see you all.
Hi, folks.
Good to see you. Okay, so that's 7 o'clock, 7:02, and I welcome you to SDS Thursday. My name is Dr. Julia Budnik, and I'm one of the directors of SDS Seminars, and my co-director and the founder of SDS Seminars, Paul Grantham, will talk to you a little bit later. And I just wanted to mention that many people are watching us on YouTube because we put recordings of these SDS Thursdays on YouTube every time we run them. And if you're watching us on YouTube, can you please subscribe and hit the like button if you like it, because that will help other people to find this video more easily. Even better, you can copy the link and share it on social media with your colleagues, with your friends, with those who you think this topic might be of interest to. So that will be great if you could do that. And of course, even better is to sign up on SDS website. I'll show you how to do it, and come to SDS Thursdays live. So while we're still letting people in, because it's still happening, we've got 126 participants already and people are still coming in. What I want to do is to share my screen with you and to tell you exactly that, how to find SDS website and how to find the course which we will be talking about today. Okay. Is it showing? Yep, I hope so, because otherwise you would have told me that it doesn't show. So this is SDS website. So it's skillsdevelopment.co.uk. And right here on SDS website, it is where you can sign up for SDS Thursdays. You put your first name, last name, and an email address. We're not asking for anything else. And exactly in the same place, you can find our upcoming events. And on the 5th and 6th of May, we will be running this brand new course, which is a part of what we call a trauma season. So we're opening our trauma season with the 2 half-day course with the clinical psychologist, Eva Russo, who you will meet today, and she will explain to you in greater details what is trauma-informed practice and why it is important to learn it and why it is important to learn it now. Okay, so I think that's enough of me. Paul, I'm very happy to pass the microphone to you to introduce our speaker formally. Please unmute yourself and go ahead.
Thanks very much, Julia, and good evening, folks. I've been sitting here musing about the fact that I've actually been working with Eva for, I would think, towards about 2 years, and I have only discovered how to accurately pronounce her name this evening for the first time. So I sit here in mild surprise and embarrassment. So I'd like to welcome you to Dr. Eva Russo, who is a clinical and counselling psychologist, an unusual, I hope you appreciate, unusual combination. And she also works as a systemic psychotherapist too, and is a consultant in trauma-informed practice. So that really sort of dominates her practice in many ways. And actually she's been involved in a range of trauma-related subjects, basically for about 15 years now, both in the UK and abroad, and is involved therapeutically and with training, supervision, and also for organizational consultancy in a wide range of organizations. But they, maybe not surprisingly, they are often organizations that are at the forefront of working with a clientele with complex trauma problems. So she's had a lot and continues to have a lot of involvement with the criminal justice system, with forensic mental health, with the social care field, with homelessness, and also, of course, with the women's sector as well. So she actually focuses on this particular area and has a particular interest additionally in working with survivors of gendered violence, and has worked with a number of specialist services in that particular field. As you know, she's going to be leading a 2 half-day event on the 5th and 6th of May. So that, I think, if my memory serves me right, is just under about a fortnight's time. But as Julia also pointed out, we have an early bird discount which extends until midnight tonight. So with that slightly elongated and elaborate introduction, I'd like to welcome Eva to our event this evening. And yeah, thanks very much for being here, Eva. It's good to see you.
Thank you very much, Paul and Julia, for the invitation. And hello to everyone. It's great to be here and meet the community. I know that it's been going on for a couple of years, and I'm very happy to be here tonight.
Thanks very much. I mean, what I just wanted to do was to give both me and folks here this evening some ideas about basically what trauma-informed practice actually is, and how you're going to be getting into more detail about that on the 5th and 6th of May. So let's start off with some fairly, well, what I hope are basic questions, which is, what exactly is trauma-informed practice? And am I right in thinking it's different in some way from trauma therapy?
Yes, absolutely. I'm glad you're asking this question, because there is a lot of confusion. Although this term is now being heard more and more, trauma-informed practice, it is important to say from the beginning that it is not a trauma treatment model. It's not a psychology model, and it is not a therapy approach. It is a way of interacting and understanding trauma and its impact. And for me, it's also the context that can hold trauma therapy, but also any other kind of therapy. So the course will not cover any kind of therapeutic approach, but it will talk a lot about the basis, the trauma knowledge basis that we all need to have, and also about all those other aspects and elements of interactions, of practice, of environments, of processes that can better support survivors to engage in therapy and to have better outcomes.
So have I got that right? It's almost like the context, the background to the work that one might be doing with folks who have experienced trauma. Have I got that right?
Yes, it is a framework. It is a framework that invites us and guides us to reflect on our practice, to reflect on how we do things, how we make our interactions emotionally safe, how we empower people through not only the therapeutic discussions, but also every other thing that we do, from the language we use in our website, or from the way that we might negotiate a disagreement, or the way we might negotiate boundaries. So it is directly relevant to everything we do, but it is a framework. And it is not only for the work that we do with trauma survivors. It is something that we use with everyone. We can use, and it's actually a good practice to use with every client and every interaction we have.
Okay, that's as always, that sort of raises for me sort of more questions, really. Can you just say a little bit more about why having a knowledge about trauma-informed practice is important over and above whatever particular skills or modality or therapy one is using with trauma clients? Why is this an important addition or an important context?
Mm-hmm. Well, first of all, I would invite us to think a little bit, who are the trauma clients? Because sometimes this is very clear. People may actually come into therapy, they might come into service and say, I am a trauma survivor, I have experienced trauma, I want to work on this, and this is why I'm seeking therapy. but people may also seek help for other difficulties they have that they may or may not relate to trauma. And there are also types of trauma that may not be conscious for people. So if someone has experienced very early life trauma or pre-verbal trauma, they wouldn't necessarily be coming for us for therapy saying this is what has happened to me. They might be coming in for treatment for depression or support around their parenting, difficulties in their relationship. So there is no requirement to necessarily know and confirm a trauma history in order to work this way. We work in this way with everyone. And for those who have experienced trauma, it makes a big difference. And for those who haven't, it's still good practice. So it works either way.
Okay, so these are important principles, because if I've got you right, if I've understood this correctly here, in a sense, we don't necessarily know who is walking through our door to see us. We don't actually know what their problems actually are, and actually trauma may be having an impact on them, even though it's not the presenting problem that they come along with. Have I got that right?
Yes, yes. And, you know, we could expand on that a little bit more as well, to consider that people who have experienced long-term abusive situations, some elements of that might have become normalized. So a lot of their experience has been like that, so they don't necessarily term it as traumatic. Of course, the framework does invite us as therapists to ask about trauma in the beginning and to know how to manage early discussions without inviting so much detail that it's not yet safe, because we won't be doing any processing work in the first session or two. So it gives a lot of tools to the therapist as well to consider what is a safe pace and how do we do this collaboratively with our clients.
Well, that sounds so important. Can I just say before we continue here, I forgot to mention this to folks. If questions are crossing your mind as Eva and I are talking, please do pop them into the chat box, because we will have a Q&A section at the end. You can equally ask Eva questions directly as well by raising your hand. But if things cross your mind while we're exploring this together, and you think to yourself, oh gosh, I'll forget that by the time we get to the Q&A, just pop it into the chat box and we'll try and pick up as many of those as we actually can. Coming back to this idea of context and not necessarily knowing what people are going to come through the door with, I'm assuming that you don't therefore necessarily have to be working with clients' trauma in order to use this. Is it possible to go further than that and say that this is still a valuable set of principles and ideas to apply, even if the therapeutic target or the therapeutic focus itself is not necessarily the trauma?
Mm-hmm. Yes, absolutely. If the trauma exists in that person's history, for me at least, it will be somewhere in the room. It will be somewhere in that interaction. If it hasn't been processed, if it hasn't been resolved, or rather, if it hasn't been integrated, which is a word that I prefer, it will appear somewhere in that interaction. It will interfere with the therapeutic relationship. And the more aware we are of that, the more we can also be better prepared as therapists. We can understand those challenges to our boundaries differently. We can interpret behaviors and reactions differently, because we also understand that this is the nature of trauma. It's not something that clients do to us. And therefore, it really helps with our own personal emotions and reactions in some of the challenging situations that do arise in therapy. But if I can give some examples of application for this framework beyond trauma therapy and perhaps also beyond therapy, a lot of sectors are actually looking and trying to apply this model that are not providing therapy. So as you mentioned earlier, criminal justice sector is one of the sectors I do a lot of my work in. And of course, the purpose of the sector is not to provide therapy, but because they understand how much it interferes with outcomes, criminal justice organizations are now looking to become trauma-informed. There are healthcare providers who are also not focusing on trauma treatment, like a dentistry surgery, for example, would very much benefit from becoming trauma informed, because they would have that support to understand how their work aspects of that dental work can be very triggering for trauma survivors. And of course, they don't have to give a questionnaire and ask the patients that come into the surgery, have you experienced trauma? But if they understand how triggers work and what they can put in place, they can make that environment safer for people.
Right, so that's again really quite interesting. So this doesn't just cut across modalities of therapeutic working, it also cuts across contexts. So it's not just usable in terms of direct therapeutic work that's being done with clients. And that, I guess, leads on to my next question, because you've just briefly touched on it, but it was mentioned before, which is that you do work with organizations as well as individual therapists. And I was just interested, without giving too much of the game away for the 5th and 6th of May, I was just interested in, broadly speaking, how does trauma-informed practice vary when you're working with an organization versus working with an individual practitioner? How is it different, or isn't it?
So in the course, we will be thinking more how participants, how you can apply the trauma-informed practice values and principles to review your own practice. What sort of things you could take away, not only in terms of not trauma-related knowledge, if I can say it like this, but also how do these values apply in your practice. With organizations, we do a bigger piece of work because they're more complex systems. So it is not only about introducing the knowledge, which can happen through a series of training courses, but it is also supporting the organization review everything in terms of their infrastructure. And that involves the policies they have in place, the protocols, the structures that they have to support staff. And that is the second part of trauma-informed practice that is often not as much spoken about. That half of it is about the people we serve, and the other half is about practitioners and staff and the people that make up organizations. If someone is in private practice or they're working independently, it would be about that therapist themselves. So we place equal value in making sure that the same principles are there for all of us, not only for the people we serve. And I think that, yes.
Yeah, I mean,
no.
I guess that for any of us that have done work with trauma clients, we're very aware of basically the need for self-care, and not just self-care, but also in terms of having a self-awareness which facilitates an aids therapy rather than potentially hinders it. I'm just interested, though, coming back to organizations, and as you rightly say, there are many organizations where their primary aim or their primary function is not therapeutic. I'm just interested in your experience, with having worked with a wide range of organizations, in your experience, what do you think it is that motivates them to bring somebody like you in to address this particular question? Why do they do that?
There is a more and more recognition of the amount of trauma that is around us, that we experience, that we bring into our work, that we're impacted in terms of the work that we do. And also, of course, because of everything that's been happening the last couple of years. So trauma is a lot more in the forefront of people's minds. There is also recognition in sectors that organizations can be trauma exposed. So not only the frontline practitioners and therapists, but also everyone moving up in the organization, their managers, their supervisors, the people that are trying to look after the organization, they would be impacted at different degrees, perhaps, from the amount of trauma that is coming in the organization at a time where there are lots of pressures. So people are overstretched, lots of organizations are understaffed, the demand has increased, the need has increased, and the impact is felt quite strongly across different sectors.
Right, okay, so there's been a real rippling out, or a recognition of the rippling out effects of trauma, not just for frontline staff, but much deeper into the organization and further away from the end user. I wonder if you could just put a bit of flesh on the bones here. In practical terms, if you could just say a little bit about what difference you've personally seen trauma-informed practice make to the work that therapists and counsellors do. If you could just give one or two examples of how you've seen it make a difference, basically.
The first thing I would say is that I strongly believe it makes a difference to the clients who are trauma experienced. It's a big deal for them that their therapist understands what trauma is, how complex it can be in the way they experience it, how much it can interfere with all these different aspects of their life. And having a therapist that can hold space, that can see that can have conversations about that in a way that doesn't increase shame, that doesn't ask them to do something that they're not ready to do because it seems right according to a protocol, a therapy protocol, but actually works very collaboratively with them and really holds in mind that the whole person in front of them, not only the part of the self that is carrying the trauma. I think it makes a huge difference to clients, and that's from the feedback that I have when clients talk about having worked with trauma-informed, not only therapists, but also trauma-informed practitioners in other roles, in support roles that are not therapeutic roles. People know when someone can see what it is that they are carrying and is ready and able and well-resourced to respond to that. The second thing I would say is that therapists and counselors and practitioners who work in trauma-informed systems tend to be better equipped to deal with that impact of trauma. That doesn't mean that they are not affected by it. I don't think that there is a way that we can mitigate that impact proactively and put a full stop to that. But it means that we know it will happen. We know that the boundaries will be challenged. We know that we will be at risk of compassion fatigue. We know that clients may have lots of crises in their lives, that they may give conflicting priorities about what they want to work on. There may be back and forth. So knowing that and having things in place as therapists, such as reflective practice groups and trauma-informed supervision, colleagues that understand, a team that can coordinate the response, so the clients are not getting inconsistent messages if they're working with a team of people. That also helps practitioners feel that they are doing the best they can do. And for me, if we work in a trauma-informed way and we have those trauma-informed reflective spaces, we stay connected to our own values, because compassion fatigue and vicarious trauma does do that to us. We forget why we're doing what we're doing. So it's not a remedy to take away, all future potential for compassion fatigue or vicarious trauma, but it does give us some very concrete tools to think about how we can look after ourselves as well as our clients.
Okay, I mean, I guess that it's just such an easy thing to forget that actually at the end of the day, we get affected by this work, really. And obviously sometimes the effects of that are in a strange way to make us less aware of it. So yeah, that's really helpful, thanks. If you had to, I know these are terrible questions to ask, but I'm just interested, if you had to highlight just one thing from the multitude of possible changes, what do you think would make the biggest difference in the trauma-informed practice field? What one thing would make the biggest difference from your perspective, and why? I mean, obviously there's going to be a lot within the training over the 2 days, but I'm just interested if you had to pick out one thing and said, if only I could get practitioners, if only I could get organizations to really grasp this this one thing, it would probably make the biggest difference. What would be that one thing that you would pull out from all the other things that you would see as valuable in this field?
I will go back to what I said earlier about organizations looking after the people that work for them. The people make the organizations. So for me, the biggest difference would be for any system, if it is a system of one private practice, or if it is, you know, a large national organization, that they give equal attention to what is actually and substantially needed for the workforce, because that's the thing that's missing right now. I think a lot of organizations are doing amazingly in terms of understanding trauma in their clients and putting things in place, developing practice, giving people choices, but there is still a lot of lack of consistent support and breathing space for practitioners. So that would, and for me, that's an act that it's a way of thinking that evolves further. You know, if your practitioners are well resourced, if your therapists are actually have a breathing space and are able to reflect on what they're doing and stay connected to their values, then the clients will benefit from that. They will not feel that they have to protect us from the trauma that they bring. They will see a therapist that is actually well resourced in himself or herself or themselves.
Well, that's really a sort of an interesting point, because let me put this to you. Let's say that I'm in private practice or I work alone, and I am conscious of the impact that working with trauma clients has on me. But actually, the only thing I have available at the moment is maybe supervision once a month. Are there other things that I should be considering doing to basically look after myself at all?
Yes, certainly. And one of my aims for the second day of the course, that is more the application of trauma-informed practice, is to support people to develop a plan. Because if someone works in private practice, then it is the weight of the world in one's shoulders. Yeah. At least that is what at times has felt like for me. So having a space where, and information obviously through the course, where individual practitioners and therapists can say, what do I need? You know, do I need to be connected to a network, trauma-informed practice network? Where are the opportunities for practice exchange? What's my development plan in terms of trauma? Where are my reflective spaces? Is supervision trauma-informed? What's my monitoring processes for compassion fatigue? What's my resourcing mechanism? So we know a lot of that, but in practice, we just get on with supporting people. That's what we do. That's why we're here. So I'm hoping that this is one of the things that will come out quite clearly from the course.
That's fabulous, and I think that's a great point for me to stop asking questions, really, and to say thank you for that, but to throw it open really to other folk, and to basically invite questions. If I could pass that over to you, Julia, if there's, I don't know if there are questions in the chat box, or whether folks want to ask things directly.
Thank you, Paul. Thank you, Eva. We have lots of questions in the chat box. Some of them, I think, Eva more or less already answered, but I will go through all, well, try to go through all of them, even if for a brief recap on some of the issues. Before we move into questions, I just wanted to answer a couple of direct messages which I've received from people who say that they can't make the first day of the training or the second day of the training and worried about it. So yes, you will always, for all our Zoom trainings, you will always receive a full recording. And if you're missing part of the training or even the whole training, you can watch it as a recording, and our Zoom recordings are there for you to keep. So you will be able to watch it whenever you need to remember some bits of the training. So please feel free to sign up and to participate if you can, as much as you can in a live training, but the full recording will be given to you. I gave you the link in the chat box, and I'll do it again. Please follow the link to get to the course. And also from that page, you can see other trauma courses which we are running as part of the trauma season. And of course, by posting that thing, I've lost my previous point of the question. So very briefly, because I think you more or less already talked about it, Eva, Colin is saying, I'm wondering what trauma-informed practice is based on or comes from. So just a tiny bit of history. How did it come about, please?
As I said, it's not a psychology model, so it wasn't. It's not held or created by one discipline. It has come together through the experience of people working in the forefront for decades with survivors of trauma, and with the increased involvement of survivors themselves. So that's why the frameworks that we have come from, the original ones come from the women's sector or from the homelessness sector, but now they are becoming more widely used.
Thank you. Thank you. John is wondering, can an approach really be used with everyone, or could it be less effective with some groups?
I wouldn't think that it's less effective. I would think that perhaps for some groups of people, it wouldn't make a difference. It would just be good practice. It would be a positive or neutral experience. But I wouldn't see a situation where it would be harmful for anyone to interact with a trauma-informed practitioner.
Thank you. Lydia is asking, can you give us an example of trauma-informed practice in relation to a client you've worked with? Maybe just a couple of pointers of what makes the difference.
Mm-hmm. Maybe I'll give not a specific example of one client, but I would say that as part of working in a trauma-informed way, I will reply to emails from clients who inquire about therapy, and I don't have capacity to take on people, thinking that this person might be a trauma survivor. So of course, usually when people first ask, they will not give all the information or the background. But for me, that could be a trauma survivor. So I need to acknowledge, I need to respond in a perhaps more tailored way rather than have a blanket response that I give to everyone. And I would also consider what sort of information is out there and in what language is out there if I have an online profile, for example.
That's amazing, because even such basic things will be shaped slightly differently. Thank you. Thea is asking, in working with people with cancer who have experienced previous traumas, how would we be able to use this approach? So cancer and trauma in the past.
Mm-hmm. Well, one of the things that we will be talking about, especially in the first day of the course, where we will be looking more at some of the knowledge that is now available to us, is how trauma is stored in the body, or how much of the trauma happens to the body. So when people have a physical condition, or they have some, even if it's not a diagnosis, it's a physical symptoms, we want to be thinking of whether there is some aspect of that, or if there is a trigger arising from that physical condition that could bring up memories of trauma. So it's not a straightforward answer, I appreciate that, but it is important to say that trauma is very much held in the body, and we do know that now. And that really changes our perspective of what trauma healing is in general, because for a long time we have been thinking of it as something that happens from the neck up, and if we just discuss the right things it will be okay, but we tend to forget the rest of the body and how the body remembers and how it carries that experience.
Thank you. Long question from John. I'll try to read it through. John, if it doesn't make sense, feel free to unmute yourself and weigh in. So the question is, if the aim of the organization is not therapeutic, how safe is the space? The expertise of someone working directly with mental health may mean they are more experienced with these matters. Does it make sense to you, Eva? Or we will ask John to unmute himself and ask the question, because I feel like there's more behind the question. John, are you here?
Oh, yes, I am. Hello, can you hear me?
Yes, we can.
Okay. No, I just meant if the aim, so if the aim is not sort of therapeutic, like an organization, is it still as safe of a space? Because if you're in like a therapeutic role, you might be more experienced. That makes sense. Is that a bit clearer?
What do you mean a safe space? What would be a safe space? The interaction with that client that comes into contact with the organization?
Yeah, just because you'd be more experienced as a mental health practitioner, I meant, compared to someone that might be just ordinary. Does that make sense?
I think the model is also very much, it takes into account that a lot of people who interact with trauma survivors will not necessarily have any kind of therapeutic background. So prisons, for example, who are becoming trauma informed, the prison officers and staff will not go into a counseling course before they can return and implement this particular approach. But what they are learning is how to not make assumptions about behavior, to consider that many of the people that are in prison will have traumatic experiences, and they will think of aspects of that interaction that may be triggering and causing more escalation, more aggression, and therefore putting people at risk. So one of the aims of this model is to increase safety in environments. I don't know if that answers your question, but there is certainly not a requirement to have a therapeutic background in order to engage with this framework. I do need to say, though, that the course, in the way that I have prepared it, is for therapists, and it is for practitioners who will want that second and third level of knowledge about trauma, not only the introductory or the awareness elements.
Thank you. Marilyn is asking, and I think I know what you're going to answer. How does EMDR sit with trauma-informed practice?
Mm-hmm. So, of course, EMDR is a particular treatment model. I would say that any EMDR trained therapist here will find some of the things we'll be talking about familiar to them, but I would hope that they will get some other kind of guidance and ideas around thinking the context within which that EMDR therapy takes place. But there is certainly not an expectation that, oh, this must replace that, or that things do not cannot be incorporated. On the contrary, I would think that a trauma-informed way of working fits really well with any other good practice model, and it would be aligned with any trauma treatment model, of course.
Yes, thank you. And Ghazala is asking, can you please advise about trauma-informed practice for clients in neuro-rehab recovery?
In neuro-rehab recovery. Okay, so I don't think that I can say a lot in the context of this discussion, and also in the course we will not be looking at specific presentations outside of the trauma presentations. But what I would say is that for a trauma experienced person in neuro rehab, they would really benefit from having people working with them who also understand the trauma, because that is not irrelevant to their experience. It will increase the likelihood that they can benefit from the service they are receiving, even if it's not trauma focused, if that makes sense.
Yes, it does. And I think the key word which we've come together with is framework. And I think it's actually very fortuitous that we're starting this trauma season with this particular course, because if we build this trauma-informed practice framework, then everything else in terms of specific applications towards trauma from compassion focused therapy, CBT, ACT, or whatever we are working with, will fit within this framework. Is it fair to say?
Yes, yes, absolutely.
Yes, thank you. Well, thank you very much. Do we have anybody who wants to raise their hand and ask Eva a question in person? Suzanne, please unmute yourself and go ahead.
Hiya. It's not so much a question, but it was just to say that I work for Priory and in an acute mental health admission ward, and obviously we do have a lot of people with trauma coming through our doors, but obviously a lot of people who were not aware of trauma. We're actually integrating trauma in practice, especially with our approach to keeping people safe in our restraint training, and we're including that in our training as well, making people more informed about how our interactions can impact and potentially re-traumatize people inadvertently. So it's just absolutely fantastic, and this is becoming more of, I think, more of a good topic of discussion for practitioners to be really positively impacting on our clients, because we want to help. We don't want to cause harm, even indirectly, by not necessarily kind of thinking about how our interactions, our environment, and what we do and say can impact them. So thank you for, I just wanted to say thank you really for putting yourself out there and making this a really good topic to talk about.
Thank you. And thank you for your comment, because it's wonderful to hear that this is happening. Colin, please.
Thank you. Yeah, I just in a way want to echo what Suzanne just said, but I work with quite a lot of autistic people, adults, and the experience of many autistic people is that they, right from almost from birth, they have complex trauma. And for lots of other organizations, whether it just be going to the doctor or the dentist, they really struggle. And a lot of people in these organizations, they don't really understand that actually what we're dealing with here is someone who's been traumatized. So I think this is fantastic. I have heard of trauma-informed practice, didn't really know very much about it. I'll be coming to it to find out more. But I just wanted to say I think it's great, and really just kind of to echo what Suzanne was saying. Thank you.
Thank you. Thank you. Thank you, Colin. And Carol says, totally agree, Colin. So yes, thank you. Nikos, please go ahead.
Hello, I'm very sorry for the background noise. There's a washing machine. I was very impressed by the example you gave, Eva, about the email as a kind of as a sort of an example about trauma-informed practice, really, because I was thinking that something that might be familiar to many people is that you don't get many chances to get things right with trauma survivors. So if there's a sort of a huge benefit to minimize really getting things wrong as much as possible. I could really, I think, appreciate how this, from this example alone, perhaps about the depth of thinking that may be going into this kind of framework, and how that could be potentially really, really helpful to try and engage someone who may have very good reasons to be suspicious of any kind of care.
I think that, yes, you're making a very valid point there around understanding that the way people interact with us, if they are guarded, if they shut down at some point in the conversation, or if they disengage, or other language that sometimes it's used that shows a lack of understanding around trauma, how people function from a place of trying to keep themselves safe. And this is the sort of things that we will want to get out of understanding the information around trauma and the neuroscience and the impact of it. So the things that we will be doing the first day that are very much around that trauma knowledge, it will be with an aim to make sense of it. What does that mean for a trauma experienced person? How are they trying to keep themselves safe? What invites them to get the most out of the work that we're doing together, and what might be pushing them away, although we never had that intention.
Thank you. Heather, and that will be the last question we'll take from the floor. Heather, please.
Hi there. I just was interested in the delivery of trauma-informed practice, whether it's kind of needs to be in person versus over something like Zoom or Microsoft Teams, and the impact of that barrier, I suppose. Thank you.
Are you referring to the training, the course, or are you thinking of the practices? No.
I think the therapy.
Yeah.
Well, from a trauma-informed perspective, we would sit down and think about the differences, and we would think about, okay, if we're having sessions over Zoom, does that increase safety for some clients? Is it a choice? Are we giving people more options this way? Are we having a conversation about what else we might need to think if we are having online sessions? And also appreciating that there's some possibility for people who would have difficulty engaging in face-to-face therapy that has now actually been created through the pandemic and the need to switch to more remote working.
Yeah, thank you.
Thank you very much, everyone. I'll just remind you that it is the 5th and 6th of May, and there are morning sessions from 9:30 to 12:30. So you've got morning training, and then you have your afternoon free to do your other work. And I hope you will all come to that course, and looking forward to seeing you there. Thank you very much, Eva. It was a fantastic evening. Thank you all very much. And as always, you can now unmute yourself and say your goodbyes and thanks. And we hope to see you very, very soon. Bye-bye now.
Thank you.
Take care, folks.
Thank
Look after yourselves.
Bye.
Take care.
Bye.
Bye.
Thank you.
Take care.
Thank you.
Bye for now.
Thank you,
everyone.
Thank you.